Some diseases spread faster with the hot weather, so with us here in the morning, this morning is Dr. Gladys Mendoza from the Medical City to discuss with us summer diseases. Good morning, Dr.
Good morning, Claire. Good morning to all our televiewers.
It's been so hot lately, as everyone must have noticed. And, you know, with the weather, some diseases may be more prevalent with this season. What do you think those diseases are?
Well, actually, at the first week of March, the DOH already warned us against all these diseases. And the common diseases that are more prevalent during the summer season, one would be heat exhaustion or heat stroke, in which the body's cooling mechanism actually fails. And the most affected are the very young ones, and the old ones are senior citizens. The next would be some common skin diseases, and one would be prickly heat, or what we call bungang araw, because the skin or the pores gets clogged with sweat glands. Another would be some viral infections or viral exanthems, and that would be bulutong, or what we call chicken pox, measles, or tigdas, in which it spreads easily. That's why it's more prevalent. It's contagious. And sore eyes, because the heat actually dries up the eyes combined with exposure to dust and smoke, so it gets inflamed. And of course, dengue had always been a disease all throughout the year here in the Philippines. And of course, food poisoning or gastrointestinal diseases, diarrheas, because during summer, the extreme of temperature or the heat actually makes the food more spoiled, and a lot of bacteria or virus could grow into that environment.
Ah, interesting. Okay, let's first talk about heat stroke, which is probably one of the most common. So how can people avoid getting a heat stroke?
Okay, well, during heat stroke, actually, as I mentioned, the body's cooling mechanism fails. So it's important that you stay indoors, especially during the hottest time of the day, and that is between 10 a.m. to 3 p.m. Okay, and at least drink 8 to 12 glasses of water in a day. Actually more for those people who do a lot of strenuous activities, for the construction workers or for those people who do manual work. And for the athletes, those who run, I think they have to have at least a bottle of drink whenever they run, at least every 10 minutes. And then try to make it sure that if you are already feeling the rise in the temperature, you take a bath. It's okay to take a bath at least 2 to 3 times in a day, just to avoid having heat stroke.
Cool down.
Cool down, yes.
And what about the summer skin diseases? How do you avoid getting, like you said, rashes, bungang araw? So how do you avoid getting that?
Well, aside from, of course, hygiene, that's taking a bath, making sure if you have prickly heat or bungang araw, you could use a prickly heat powder. Okay, and if it becomes worse, then you see your doctor or your dermatologist. And another, I forgot to mention, other diseases that goes with summer, as for the skin, is wading on swimming pools. Of course, you get to have fungal infection, and so try to make sure you take a bath before and after swimming.
Okay, is there a specific soap that you need to use for, let's say, when you have an
Well, yeah, actually the dermatologist could prescribe
you
some
the soap.
But it's important to use a moisturizing soap, just to make sure your skin is moist most of the time, and try to use a hydrating lotion.
Okay. Now, viral diseases, like you said, could spread quicker than usual during the summer season, like measles and chickenpox. I know there's vaccines for that, but who are the most vulnerable to those diseases? Is it children?
The children are most vulnerable, but you know, with the vaccines, we could have avoided it. But sometimes we can really say that the vaccine really works for them. So it's important that if there's already a spread of measles or chickenpox, have that person who has the disease to be isolated, and then making sure you maintain a clean environment. Hand washing is very important also.
Right, so after going to public places, just wash your hands really well.
Yeah.
Okay, and then dengue, as you mentioned also, why is it more prevalent in the summer season, and how can you avoid it?
Well, actually, dengue had been prevalent all throughout the year.
Okay.
It's more prevalent during the cold season.
Okay.
But right now, there's actually an infestation of a lot of mosquitoes. But you could avoid it by using lotion, Okay, try to maintain a clean environment. If there is stagnant water within the house, make it sure you clean them and then cover all containers containing water.
Now, if you live in an area where you know there's stagnant water nearby and that you know it could be a breeding ground for dengue mosquitoes, is there a place that they can call to report?
Well, there are, you could call the DOH. They could do something about it. They could actually come over and then help
do
to,
something.
if there's an outbreak. Actually,
Right, in the area, just to report it, correct? And also, what are the other advices that you can give to other people
during summer?
During the summer season,
okay.
yes.
During summer, well, it would be better to stay indoors during the hottest time of the day. That is between 11 a.m. or 10 a.m. to 3 p.m. Drink lots of water. Make sure you consume 8 to 12 glasses of water. Take a bath very often or try to do some activities which are better done indoors. And of course, to avoid other diseases, communicable ones like measles, have the kids vaccinated. And for the elderly, make sure you try to watch them because, you know, they are the ones vulnerable to develop dehydration. And then with regards to food preparation, aside from hand washing, make sure if there are leftovers or viands, you put it in the refrigerator. And if you're gonna buy food, make sure you try to observe. You try to see if the smell is already rancid or not good. And if there are bubbles in it, most probably that already turned bad. So try not to consume it anymore. And try to avoid eating those who have sauces or cream, if ever you're gonna buy elsewhere, like a carinderia or something.
Yeah, or because you don't know if the actual meat is spoiled because it's, I guess there's other, you know, there's the tomato sauce or the cream, so you can't taste it. So yes, be careful with what you eat these days and what you buy in the grocery and make sure it's fresh and not rotten or spoiled. Okay, thank you so much, Dr. Gladys Mendoza, for coming to Daybreak this morning.
Thank you so much for having me here, Claire.
Thank you. That was Dr. Gladys Mendoza of Medical City. Now up next, the Supreme Court gets ready to tackle challenges to the legality of the H or RH law tomorrow. And have you heard about lipstick art? Well, we'll tell you about that in a bit. Stay with us.